Hello, my name is Lillian Schmitz, and the date is May 8th of 2021. On the back of my note card here, I just have terms to follow along with for my presentation. So today I dissected a sheep heart. So we've got our heart right here. And the first thing I'm going to go over is the superficial features. The first superficial feature is going to be the epicardium, which is also known as the visceral layer of the serous pericardium. And that is just going to be what surrounds the entire heart. So that's just going to be that layer that surrounds the entire heart. The next superficial feature is the coronary arteries, which are not very visible on this heart, but I will go over them. So they originate at the base of the aorta, and there are going to be two types which branch off into two other arteries each. So we have the right coronary artery, which is going to branch off into the right marginal branch and the posterior interventricular branch. And then we have the left coronary artery, which is going to branch off into the circumflex branch and the anterior interventricular branch. So those branches kind of explain where they are on the heart. So you can assume the anterior interventricular branch is going to be on the anterior side of the heart and between the two ventricles. So it kind of lives right in these kind of grooves here. Next, we're going to go over kind of the internal structures of the heart. So first we have, we're going to go over the right atrium. So we have our superior vena cava here. Here, I'll show you right here. And this is going to enter into our right atrium. So deoxygenated blood will enter into that right atrium. The right atrium has a valve between itself and the right ventricle, and this is called the tricuspid valve. So this valve is not visible in here, as I think it was destroyed while I was dissecting this, but it is right between here, right between the atrium and the ventricle. And then finally, in the right ventricle, what's going to happen is the blood, the deoxygenated blood, is going to leave through the pulmonary trunk, or into the pulmonary trunk through the pulmonary valve. And this will just bring it right to the lungs, bring deoxygenated blood to the lungs. Next, we're going to go to the other side of the heart. So we're going to move over to the left atrium. So the left atrium is up here, as you can see. It isn't really existent anymore, but it used to be kind of right up in there. So that's our left atrium, which our pulmonary veins are going to bring oxygenated blood to this left atrium. And then what's going to happen is the blood is going to go down through the mitral or the bicuspid valve into the left ventricle. So that's down here. So the valves, like I said, were destroyed while I was dissecting this, but also you see here these strings, your heartstrings, those are going to be your chordae tendineae. So that's what these are. And those function to pull, they hold that valve down and keep it kind of taut. So that's what those are used for. So next, what we're going to talk about is the ventricle. So we're back down at our left ventricle. And what happens is blood's going to exit that left ventricle through the aortic valve and then into the aorta. And this will pump that oxygenated blood through the rest of the body. Some other features are going to be the interventricular septum. So that is this right here. And that is what is going to separate the two ventricles, the left and right ventricle. Next, we have our endocardium. So the endocardium is the layer of the heart that is going to surround the internal features. So as you can see kind of right here, inside of those, the atrium and the ventricles, there is some tissue that surrounds those insides, and that is going to be the endocardium. The myocardium is the muscle. So that's the muscular layer of the heart. So as you can see, the muscular layer here and here, that's going to be our myocardium. And that is all I've got for you today. Thanks so much for listening.